So, hello friends, welcome to the class. So, in last class, we talked about vertebral column. So, which is very important for our body as well as to protect the spinal cord. Okay, so nature give us vertebral column. So, basically, there are 31 pairs of bones. All are there, 8 in cervical. Okay, 12 in thoracic region. Okay, and 5 in lumbar region, 5 in sacral region, 1 in coccyx. Okay, so we talked about in detail how the vertebral canal works and what are the importance of vertebral canal. Now here we have the one of the important topic, that is, so basically so which medicine will directly work on vertebral column or spine or brain. So in electrohomeopathy, we have three remedies. Okay, basically one is for central nervous system. Okay, so our topic is skeletal system. So that's the reason here we can add one more medicine, that is known as C4. C4 is the medicine which mineralized, okay, which improve the mineralization in the body. So with that help, our bone necessary things like calcium phosphorus, calcium carbonate, which will improve and which will settle in the bone and will improve our calcium efficiency. Okay, so as well as in the CNS, we have three remedies mainly, F1, F2, and WA, which work directly on central nervous system, which work directly on central nervous system. Okay, so today we will talk about, excuse me, herniated disc. Herniated disc. So today we will talk about here herniated disc, then afterwards ribs. You know, the vertebrae are separated by disc of fibrous cartilage that act as cushions to absorb the shock. So why we have disc in our vertebral column? So because whenever you will do running, you will walk, okay, you have to wait, you have to lift the weight. Okay, so whenever there the possibility of getting shock upon the vertebral column, so which will help our vertebral column have disc. So this is the vertebral column, one vertebrae, second vertebrae, in between one vertebrae we have disc. This is the disc. This disc will help for getting shock. It is shock absorber. Okay, an anterior vertebral disc has tough outer covering and a soft center called the nucleus pulpus. Okay, the outer covering, sorry, interior vertebral disc has a tough outer covering. So the covering is with tough fibrous connective tissue. Okay, so which is named as nucleus pulpus. Okay, extreme pressure on a disc will rupture the outer layer and force the nucleus pulpuses out. So whenever you will you lift the heavy weight, okay, whenever you fell down or any injury occurred to the spinal cord, so what happened, this disc, okay, here you have the diagram, this disc, this is the outer portion of the disc, nucleus pulpus. Okay, nucleus pulpus, it will rupture and enter into the this area. This is called, this is the nerves, spinal nerves. Okay, this is the spinal cord. Okay, here our spinal nerves will release. Okay, so this disc will give pressure on the nerve. So what will happen? We will have pain. What we have? We have pain. We have pain. Okay. This may occur when a person lifts a heavy object, okay, improperly. So whenever you have to lift the weight, you will not able to. It is not farther than your body. Please bring that object near to you, and you have to lift very carefully. More pressure on the legs, then spine, then hands. So if you are not giving the pressure on the legs, so directly that pressure will attack on the spinal cord. Okay, so basically, whenever you are lifting the object, please make sure that you bring the object near to the body. So if the object is more farther than the body, it will make more pressure on the body. Okay, if object is more near to the body, then the pressure will low. Okay, so that is the first thing. Then is using the back rather than the legs. Okay, first you have to use your legs back as well as both, not only the legs, not only the back. Okay, and jerking upward, which puts sudden intense pressure on the spine. So if you are taking suddenly, it will make pressure on the spine. So you have to wait, lift very carefully. Okay, put pressure both on the legs and back. Okay, so then only your disc will protect. Then if not, like most of the things we'll see in the ladies, that they will work on the cold region, always their palm on the cold. They uh, wash the house, wash the clothes, uh, wash the eating objects. Okay, whatever may be that, they are always in the cold region, always. They wet their legs. What will happen? It will improve the pain in the legs. Okay, and always standing, which will put pressure on the back. Okay, which will put pressure on the back, able to herniated disc. Okay, so these are the complaints which able to see in the mostly in the ladies as well as in gents. Like they always ride the bike. Okay, so they always ride the bike, they always uh, uh, make sure they will able to lift the weight. Okay, so there are the multiple cases which is coming in front of us of disc bulge. This is the most common and the most every in 10 persons you can come, yeah, every 6 to 5 members having same complaint of back pain due to the disc bulge, due to the any problem. They complain low back pain. Although often called slip disc, the affected disc is usually not moved out of position. So basically, this is the position of the disc. Always it will here only. Okay. So if the disc move frontward, what will happen? It will give pressure to the nerves, spinal cord or spinal nerves. Okay. The term herniated disc or ruptured disc more actually describe what happens. The nucleus pulpus is forced out. So this is the nucleus pulpus. Okay, often posteriorly when it puts pressure on spinal nerves. For this reason, a herniated disc may be very painful or impaired function in the muscle supplied by the nerve. So whenever this happen, they will see the neurologist. Neurologist will advise, please do discectomy. Okay, discectomy means cutting of the disc bulge. They will cut this disc. Okay, and they relieve. They will, if they if there is more pressure on the nerves on the backbone, they will do laminectomy also. Laminectomy, discectomy, removal of the disc, removal of lamina. Okay, so this is the most common surgeries nowadays we are seeing. Okay, often posteriorly when it puts pressure on spinal nerve. For this region, a herniated disc may be very painful or immense function the muscle supplied by the nerve. Because very painful means here the sensory nerves, motor nerves, all nerves are releasing from the spinal cord. Okay, so that's the reason the pain is most unbearable pain. Patient can't able to sit, patient can't able to sleep, patient can't able to sleep, or even walk. They, he cannot able to do daily routine. Why? Because the nerves, damaging of the nerves, pressure on the nerves. Okay, so we have to remember, we have to check the patient whenever, whenever a patient coming from the herniated disc. We will see what are the symptoms, how we will check. Okay, now we will see about that. Okay, because it is a regular, regular clinical presentation of the patient nowadays. Okay, healing of herniated disc may occur naturally if the damage is not severe. Basically, if it is not severe, if you give relax to this area, the disc bulge will relieve naturally also. And the person's rest, and it makes sure it will take 3 to 6 months. Okay, so if the patient have ability or he has strong will, then this will very good for him. The would further compress the disc. Surgery may be required, however, to remove the portion of the nucleus purpose that is out of the place and distracting nerve function. So this is all about herniated disc. So what are the symptoms? Can you see the symptoms? Here we have the another diseases called abnormalities, curve of the spine. So basically the curve have forward, then backward, then forward, then backward. Okay, so this is the structure of the spine. Basically, because if the pressure will put here, it will release the pressure from here, here, here. It is very more stronger. Okay, which is more stronger? If it is a spine like this, vertical, it is spinal, not spinal, vertebral column. It is more stronger or it is more stronger. If you put pressure on this, single pressure will not handle here only. It will here, it will release here, here only. It is a balancing way. So that's the reason the natural nature give us the structures of spine like this, and as well as you will able to sit down. Okay, if this is the straight, you will not able to straight. Always your spine is straight like this, like pole. You will able to sit. You will able to pick up the object from the ground level. Okay, so you will able to run. So these are the things which is helpful when your spine is in curve shape. Okay, so there are the multiple uh, conditions in which the curvature of the spine will get damaged. They are the first things: scoliosis. This is the lateral curvature, which may be congenital, it may be from the birth. Okay, this will happen. One second is kyphosis. Thoracic curl will damage here. Lordosis. This is a lumbar curve damage. Okay, lumbar curve damage. These abnormal curves are usually the result of degenerative bone diseases. Why this is happening? Because if the spinal cord, spinal bone or vertebrae, single vertebrae shape is not is it right current position, so what will happen? The curvature of the spine is very difficult. Okay, so these are the different types of abnormalities of spine. Okay, next we have the rib cage. First of all, we will see the symptoms of back pain and what are the herniated disc. How physical examination we have to do whenever a patient will come into our clinic. Let's see that. Whenever you have to do first You have to do what you have to do. MRI give clear picture, but you have here one test that is called leg rising test, straight leg rising test. If this is the 80 to 90 degrees, this is the 40 degrees. If the patient is complaining pain in this area, this is the sciatica nerve. Okay, this is the disc bulge. You have to able to see the picture clearly. Okay, we will see, save the image. Okay, so this is the disc bulge. Okay, this is the disc bulge. So whenever you are when you are telling the patient, please lays one leg is flat and hip on the table, both everything is in flat condition. Okay, only he have to raise the leg. If the patient is raising the leg and he doesn't have the pain, means he have another problem. If the patient have pain, if they have disc compression to the nerve, when he raise the leg, he will complain about the pain. So this is the case of disc bulge. This is the most important and most common test which is done by neurological or neurologist. Okay, this is the test is positive when the pain occurs with less than 60 degrees of the hip flexion. So you have to raise the leg. If it is below the 60 degrees, if you have the pain, then straight leg test is positive. Okay, and you are able to see the disc bulge in the MRI. How in MRI or X-ray? First we say X-ray. X-ray of herniated disc. Okay, you can see that this is the X-ray. See, in this you will able to see that this area is raised. Okay, which is compression. These are the normal disc. These are the normal disc. You have the disc bulge. In MRI, how can we see the disc bulge in MRI? Let's see. MRI lumbar spine. So you can see here. This is the MRI. Mm. This is the clear picture. You can see here. You see. These are the. This is the vertebra. This is the spinal cord. Okay. This is the black. This is here. The disc is bulge in the. This is the L3, L4, L4, L5. Okay. L4, L5. Disc bulge. You are seeing here. Okay. Then this gives a clear picture of disc bulge. Okay. So we talked about the physical examination. We talked about how the disc bulge will seen in the X-ray as well as in MRI. Okay, I hope you understood. So what is the treatment for this? So we can talk about the treatment also, because this is very common. This is a very important thing. That's the reason I am explaining here. Let's see in the basically First thing, why this disc bulge happened? First thing is, in you have to think in three categories. As my opinion, you have to see in three categories. Okay. First, it may be nutritional deficiency. Okay. Next is any pathological reason, and third is age. If you divide this disc bulge or anything, okay, any vertebral disease, lumbar or cervical, you can see these things in cervical also. So whenever the patient came into clinic, it may be male or female, okay, he is telling that I have the leg LBA, low back ache, as well as I have the pain radiates to less right leg or left leg. What will you will do? First of all, you will able to examine the patient where there is a pain, there is tenderness. Tenderness means if you are touching the area, the patient is not able to tolerate. Okay, and you are doing the leg rise test, it is positive, and you have tenderness means these signs are giving you that there is any problem in that area. Okay, so first it may be nutritional deficiency. Ask the patient about his nutrition diet. Is he taking, because bones need calcium, bones need vitamin D3. Okay, these are the very important. Okay, so and as well as vitamin C also needed for collagen improvement. We studied in the topic. Okay, so these are the main important nutritions which our body needed. So is he taking this diet regularly? How is a daily routine? You have to ask the patient. First thing, it may be pathological. Pathological, it may be various. If he have any past history of the disease, sugar, hypertension, and as well as any uh, infectious diseases like TB, cervical TB, lumbar TB, or thoracic TB. Coaches is the most common word which utilize. Okay, and any infection. Okay, next age. If he is more than 40 to 50, 60 years or 50 years, degenerative disease. Degeneration is most common in this age. Degenerative disease. So it depend upon this. Depending upon the condition, depending upon the condition, you have to advise the patient. Okay, depending upon the condition, you have to treat the patient. If there is nutritional deficiency, advise the patient about calcium diet, vitamin D3. You can bring the from the sunlight. Okay, and vitamin C. Okay, you can take from the foods. Okay, like You have amla. Amla have more vitamin C in all categories of the vegetables. Next, if you have the disease, you have to treat the patient according to the condition. Okay, and the third thing is degenerative age factor. Degeneration needs also nutrition as well as other things related. Okay, and you have to advise the patient about exercise. You have to give the patient exercise to bring the disc into the normal position. Okay, so it will depend upon the patient which type of exercise you have to advise. Most common exercise you have to able the patient is low back strengthening exercise, lumbar strengthening exercise. Okay, so in this condition you can treat the patient, and you have to advise to take the rest to the patient 3 to 6 months, because if we have any disease, naturally it can be cured by giving rest. Rest is the only one and only, without medicines, without thing, if the patient have immunity power. Okay, if you are giving the patient rest, it will boost his immunity, and as well as it will heal the body. Okay, without proper rest, proper natural diet, light exercise, and taking the medicines will cure the disease. Okay, so basically this is all about our herniated disc treatment. Okay, so next is depend upon the condition, we have to treat the patient. Other things will based upon the condition. Okay, next we have the topic called ribs. So basically we have 12 pairs of ribs. How many pairs of ribs? This is the sternum. In the sternum it is attached to the ribs, which protect the lungs, which protect the heart, okay, which protect internal organs for damaging. Whenever you fell down, whenever you have the injury, whenever you have the traumatic injury, RTA injury, anything. Okay, so the sternum upper side is called manubrium. This is a body and the sphenoid processes. Here you have the image. This is the sternum. Okay, this is the sternum. Okay, this is the manubrium. This is the sternum body. This is the xiphoid process. All those, everything will attach to this sternum only. Okay, these are the ribs. First rib, second rib, third rib, fourth rib, fifth rib, sixth, seventh, eighth, ninth, 10th, 11th, and 12th. 12th is floating rib. Okay, the all the ribs articulate posteriorly with the thoracic vertebrae. So from front, this is coming from the sternum, and posteriorly backside it will attach to the thoracic region called vertebral canal. Vertebral canal. The first 7 ribs are called true ribs. Okay, basically it is directly attached to the vertebra. They articulate directly with the manubrium and the body of the sternum by means of costal cartilages, and between have costal cartilages. In between the ribs, we have costal cartilage which support this rib. Next is false rib. Okay, why this is called false rib? There articulates joins the 7th rib cartilage. Okay, because it directly not attached to the sternum, or sorry, directly not attached to the vertebrae. It will attach to the 7th rib. Two pairs are called floating ribs. They do not articulate with the sternum at all. Okay, so they are only they attached to the thoracic region. Sorry, vertebrae. So that's the reason it is called floating ribs. An obvious function of the rib cage is that it's enclosed and protects the heart and lungs. So what is it? The protection of heart and lungs. Keep in mind though that rib cage also protects organs in the upper abdominal cavity. Liver, it will protect liver also, spleen also, and it is have flexibility. It will towards upward and backward. Okay, intercostal muscles. This enlarges chest cavity, which expand the lungs and contribute to inhalation, as well as it supports the lungs also during inspiration and expiration. So this is very, very important. You can see that here in this image. So these are called, first 7 ribs are true ribs because they articulate from the, they are coming from the directly from the sternum and articulate backward. So these are false ribs. Because this is the 7th rib. Okay, this is the 7th rib. So from this, the 1 2 3 4 5 sorry, 5 7 plus 4 11. 11 means 4 ribs are directly attached to the 7th rib, not attached to the sternum. So this is the 7th rib. From the 7th rib they are getting 8th, 9th, 10th, 11th. But 12th rib is false, not false, not true. It is floating rib because it is directly attached to the our thoracic or vertebral column, vertebral canal. Sorry. Okay. So today this is all about, okay, vertebral column. We talked about vertebral canal, vertebral column, herniated disc, everything in detail, and how to examine. Tomorrow we will talk about shoulder and arm, and after that we will continue the more topics. Okay, so today we will conclude here only. If any doubts, kindly ask.